had 3BA for about 7 months, and I'm about 7 months pregnant, so I did not know I was pregnant when I started.
Back taking the next 6 games to win the set 7-5.
News time is 12:08.
Good afternoon, Gabrielle Hodson with your 3BA local news update. A Ballarat cricket fan is devastated after thieves broke in. They would like to see me back, but how I'm going to organise that, I'll have to wait and see. It was up here before.
Usually it's down here, isn't it?
Oh, sometimes. Oh, it's all over the place, but we think maybe the head's there, so that doesn't make sense. But I don't know. It's giving me a boot every now and again. I sort of found out, and I thought, oh, I just feel normal. I don't feel like I'm pregnant. Am I supposed to feel different? And a couple of days later, I felt as sick as a dog. Then what have you got after that? Couldn't eat much. My diet was just soup and bananas, I think. Forever. Your course. Back then, I had a fair bit of hypo-awareness, I suppose, whereas now, later in the pregnancy, I'm not always sure I'm having a hypo or not. I've just got to treat it as soon as possible. You feel sick, you test yourself, you do something straight away.
And often it's 3 a.m.
GP here, he's been great. He was the first person I saw with the pregnancy. He suggested a few people, when I have the baby, they'll all be in the same building. You've got your endocrinologists there on sort of level 3 and the maternity sort of up a bit higher. A friend gave me some advice and said, look, the bigger the hospital, the more diverse the population they're dealing with, and they're probably more used to dealing with diabetics.
That does. I can't see any other purpose.
While I've been pregnant, I suppose, been a steep learning curve. You knew a bit about diabetes beforehand, but
I know a lot more now.
A lot more, yeah, exactly, yeah. So he's been very supportive, coming to a lot of doctor's appointments and seminars.
Well, I've got to be a lot more on the ball, I think, because now you're dealing with something that's a lot more sensitive. You're not just dealing with one person, you're dealing with a baby. So the blood sugar levels have to be kept down.
So Rebecca, we know your blood pressure's normal. I'm just going to examine your tummy if that's all right. See how the baby's been growing. As far as normal antenatal management of a patient with diabetes goes, visits tend to be more frequent. Just starting to enter the pelvis. We'll on average see a patient around every 3 weeks till around 30 weeks, then every fortnight till around 34 weeks, and then every week. We're particularly interested in the growth of the baby. It's well known that mothers with diabetes will often grow a larger than average baby. We use ultrasound more often than a normal pregnancy in patients with diabetes. I'm just going to have a little look at the baby. There's a little nose. To measure the depth of amniotic fluid, it's a simple and reliable test. We're a little more concerned about the risk of abnormalities, as is the patient very often. The heart beating there on the screen.
Given that last week the baby was slightly bigger on the 70th percentile, is there still a chance that I can have a vaginal delivery?
I think it's a good chance. From the outset of the pregnancy, we make no judgment, particularly with a woman's first pregnancy, as to her suitability for vaginal birth or caesarean section. We need to allow the pregnancy to unfold, to see over time how the woman's health is, how big the baby grows, and also what the woman herself hopes to achieve with the birth.
No, headache's been fine.
Diabetes antenatal clinics are probably the best example in an obstetric hospital of a combined team approach to antenatal care. In our clinic, for example, a patient can expect to see regularly not only the obstetrician and the endocrinologist, but also will see a diabetes educator, a dietitian. An ophthalmologist can check the eyes for retinopathy 2 or 3 times during the pregnancy if necessary. And also we have access to a renal physician for those women who have some kidney complications as a result of their diabetes.
I'm really looking forward to the delivery of the baby. It's only 3.5 weeks away, so as I sort of get things more organised in the nursery and feel the movements more, I'm really looking forward to meeting the little person.
We had a caesarean with Holly, and that was a planned caesarean. I trusted my obstetrician and went with whatever he said. The first time round it was more of an emergency with Chloe. There was her heart rate dropped, so he put me in within a matter of hours. Second time round I was well aware of what had happened the first time, and I was sort of a little bit more nervous about it, but in saying that, it was still the best option for me.
It was amazing just how quickly you go from not having the baby to having the baby in your arms and then giving it a bottle of milk. Like, it's a great feeling.
Holly didn't go to special care nursery. She did have low blood sugars, but they were able to manage them in the room.
We would expect most babies born to mothers with type 1 diabetes to have low blood sugars early on. This will occur within 1 to 2 hours of birth generally and is very easy to manage.
Well, being a diabetic and having 2 healthy children now, it's a sacrifice you have to make in life to manage your sugars a little bit tighter. Being on a pump, I would say for us, you know, for me particularly, but as a couple, it's just made such a difference to the management of my health and the flexibility it gives you, especially during pregnancy. And, you know, I'd highly recommend that side of things.
It's a difficult process to go through at the start. But like when you sort of sit back and look at everything we've got now, it's good. The help that Jodie received from like all of her doctors and on the day that we had the baby, it's just second to none really. It's just amazing.
I delivered vaginally, but I did have an epidural during the labour.
In preparing for the caesarean, I thought early on, okay, this is something that has to be done, so I just got on with it and accepted it, and it was easy after that.
I guess I was disappointed. It wasn't what I had hoped for, but it was the best decision as it turned out. He was a very large baby.
I kept my eye on the prize, and I was, you know, handed a really beautiful, healthy little girl at the end. That was all that mattered to me.
Being able to breastfeed was very important to me, and it still is. It's not every